Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Susan Matthews. She is the nurse director of the Outpatient Pavilion at Terrebonne General Health System. She's here to tell us a little bit more about an exciting award that they won and why they got that award. Welcome to the show, Susan.
Thanks for having me.
All right, so I'm really excited to share with everyone the Women's Choice Award information. So let's just start off first with you telling us a little bit about what you do at Terrebonne General.
I am the nurse director over ambulatory services and PACU. It's a lot of outpatient areas that feed, from outpatient or to outpatients.
Okay, and what does PACU stand for?
PACU is Post Anesthesia Care Unit.
Okay, great. So you see all the surgery patients pretty much.
I do.
All right, so can you tell us, what is a typical day like for a patient that comes to Outpatient Pavilion?
Well, a typical day actually begins before the day of surgery. The patient comes in to pre-admit, and that is where we get their history, we go over their medications, we interview them, make sure they don't have any questions about their surgery, and questions about anesthesia as well. The anesthesia RN also visits with the patient to make sure they have no questions about anesthesia or that plan of care. And then the day of surgery, they come in and we get them ready for surgery, and the OR communicates back and forth for any delays or what have you. Before the patient's taken to surgery, the nurse and the CRNA for their surgery come in as well, and they visit with the patient, make sure there's no questions again. So there's several stops that the patient, can ask questions or communicate.
That's wonderful. So they know what to expect, they're prepared, and they're ready
Right, we just want smooth sailing.
Perfect. Well, tell us, what is the Women's Choice Award?
The Women's Choice Award is actually a market research company that is the collective voice of today's female consumer. So it is really for women to help women make better choices for themselves and for families. And I'm really proud to say that for the third year in a row, Terrebonne General has been selected as one of the best hospitals in the outpatient experience.
That's wonderful. How is this award achieved?
To be eligible for the award, you have to be Joint Commission accredited. And institutions with this accreditation, it just really shows their commitment to patient safety, best practices, and quality of care. And we actually had equal to or higher than national average in patient communication, patient recommendations, and just our satisfaction scores.
Well, that says it all. When patients are happy and they're willing to recommend
that's what we do.
The hospital, that's great. So that's what we're going to talk about a little bit more. Patient satisfaction, why is this so significant?
Well, no one really wants to have to undergo surgery. You don't want to have the back pain that causes you to come in for surgery. Yet when you come, we want to make sure that you have the smoothest possible flow to your day. We want to make sure there's no glitches. We just want you to have the most comfortable stay as possible. So it's just important to us. It's what we do. It's why we go into healthcare.
Oh, great. You talked about pre-op. So what happens to patients after they leave you and go into surgery?
Right. Well, when they leave us, our wonderful surgical and anesthesia staff, I have to say, they're just so talented and so dedicated. They give the most ultimate wonderful care in the back. I can't speak any higher than it. They take care of the patient there. If it's a long case, they will call the patient's family member, let them know, hey, everything's good, it's just taking a little bit longer. We also have a text messaging system that allows the family member to know where in the whole process the patient is. And a lot of it's generated through our documentation system. So when the OR nurse opens her note, it'll send a message to the family member. And then when the patient comes into recovery room, that also sends a message to the family member that your patient's in recovery room. From there, the recovery room nurse also calls the family and lets them know, okay, they're here, they're doing fine. We gave them a little something for pain. So we do touch base, or any delays, when leaving PACU or going upstairs, we always just let the families know from there.
Right, and they're getting these messages right there on their phones, which they have
Absolutely.
in their back pocket. And well, that's wonderful. That way they know the whole journey that their loved ones
They're
are
following right along. We don't have any secrets.
on. Great.
We really don't. We let everybody, the patients, families know what's going
Well,
on
that's
as much as we
important.
know.
Because they're nervous.
Absolutely.
And you just want to make sure they're calm and have all the
Absolutely.
information. All right, well, why is this award so significant for our community?
I feel like just, little Homa, here we are, COVID, Ida, COVID, COVID again. I don't know, it's just the fact that we won it again. We were able to maintain our high standards and customer satisfaction and the whole outpatient experience. I just think it's a wonderful tribute to our staff and to our community as a whole. It's just a wonderful award. I can't speak, any more highly about the staff here at Terrebonne.
Right, and it's not just us saying that we're good, it's the patients.
This is a third-party organization giving us this award. It just further solidifies our commitment to excellence.
Well, great. Well, keep up the excellent work, Susan.
Thank
you
you
so much for being with us
Thanks
today.
for having me. Appreciate it.
Congratulations to the Terrebonne General Outpatient Pavilion for being named one of America's best hospitals. For more information or to learn more, please visit tghealthsystem.com. Thank you for joining us on To Your Health. I'm your host, Rhonda Alfred, and I'll see you right back here next week.